Arthritis pain? I have 7 natural fixes that seniors swear by. If you're a senior who's been told that daily arthritis pain is just a normal part of aging, I made this video for you. So many people think they just have to put up with aching joints, stiffness, and a life that feels like it's shrinking year by year. But I'm here to tell you, that just isn't true anymore. Are you sick of that morning stiffness that makes even getting out of bed feel like a chore? Do you find yourself sitting on the sidelines, missing out on things you used to love because of joint pain? You're not alone in this, and you absolutely deserve better. In the next few minutes, we're going to build a complete toolkit of natural science-backed remedies that can genuinely make a difference. From powerful herbs that dial down inflammation to simple exercises you can do right from your chair, I'll show you how you can get back to living your life with less pain and a lot more freedom. Before we jump in, a quick but really important reminder. This video is for educational purposes and isn't a substitute for professional medical advice. Please, make sure you chat with your doctor before starting any new supplement or exercise routine. This is especially true if you have other health conditions or are taking medications. Alright, let's start building your arthritis relief toolkit. First up is a powerhouse you might already have in your spice rack: turmeric. This bright yellow spice has been a staple in traditional medicine for centuries, and science is finally catching up too. The secret weapon inside is a compound called curcumin. Think of curcumin as your body's own personal inflammation fighting squad. Arthritis, at its core, is a disease fueled by inflammation. Curcumin goes to work by blocking the specific pathways that trigger joint pain, swelling, and stiffness. In fact, multiple studies have found that for osteoarthritis, curcumin can be as effective as some over-the-counter anti-inflammatory drugs, but often with fewer side effects. So, how do you get the benefits? While sprinkling turmeric on your food is delicious and good for you, it's tough to get a dose that will really make a difference for arthritis. For serious relief, studies often use supplements with 1,000 to 2,000 milligrams of curcumin per day. And here's a crucial tip. Look for a supplement that includes piperine, which is an extract from black pepper. Piperine can boost your body's absorption of curcumin by up to 2,000%, making it way more effective. Next in our toolkit is an ancient herb with a big modern reputation: Boswellia serrata, also known as Indian frankincense. For centuries, this plant resin has been used to calm inflammation. What's interesting is that Boswellia works differently than turmeric. It targets a specific inflammatory pathway that produces molecules known to wear down cartilage. By blocking this, Boswellia not only helps reduce pain and stiffness, but might also help protect your cartilage over the long run. A 2020 systematic review confirmed that Boswellia extract is both safe and effective for osteoarthritis, particularly in the knee. Some studies have even shown that people felt noticeable benefits in as little as 4 weeks. For the best results, you'll want a standardized extract that lists a specific percentage of boswellic acids. Those are the active components doing the heavy lifting. Give it at least a month to really feel the effects. Many people find that pairing Boswellia with curcumin creates a powerful, two-pronged attack on inflammation. I know it sounds completely backward, but one of the best things you can do for stiff, achy joints is to move them. When we stop moving, our muscles get weaker, and our joints get even stiffer. The kind of movement acts like a natural lubricant for your joints, strengthens the muscles that support them, and can dramatically cut down on pain. So, what are the best exercises for seniors with arthritis? First, think low-impact cardio. Things like walking, swimming, water aerobics, or riding a stationary bike are fantastic. Walking is a real star here. Studies show it doesn't just strengthen the muscles around the knee, but it also helps nourish the cartilage, which gets its nutrients from the joint fluid that's produced when you move. A large review of studies confirmed that aerobic exercise significantly reduced pain and improved quality of life for people with knee osteoarthritis. Second, strength training. Don't worry, you don't have to become a bodybuilder. Simple exercises with resistance bands or even just your own body weight can build a supportive cage of muscle around your joints. This muscle absorbs shock and takes pressure off the painful spots. Think chair squats. just standing up from a chair and sitting back down slowly, or seated leg lifts. A physical therapist can be a great partner in designing a safe routine that works for you. Finally, there are mind-body practices. Tai Chi is a standout. This gentle, flowing practice has been shown in numerous medical studies to decrease pain, improve balance, and reduce the risk of falls. Its slow, controlled movements are easy on the joints while boosting circulation and flexibility. Gentle or chair yoga is another wonderful option that combines movement and breathing to ease stiffness and quiet the mind. Another key player in the fight against inflammation is omega-3 fatty acids. These are the healthy fats you find in fatty fish like salmon, mackerel, and sardines. These fats, especially EPA and DHA, work on a cellular level to calm the production of inflammatory chemicals in your body. For those with rheumatoid arthritis, the science is incredibly strong. One analysis of 70 studies found that fish oil supplements significantly reduced disease activity, pain, and morning stiffness. People taking fish oil were also often able to cut back on their use of anti-inflammatory drugs, NSAIDs. While the evidence is strongest for rheumatoid arthritis, the anti-inflammatory power of omega-3s can also help those with osteoarthritis by soothing the body's overall inflammatory response. A 2023 meta-analysis pointed to a small but significant benefit for reducing joint pain in osteoarthritis patients. To get a dose that makes a difference, you'll likely need a high-quality fish oil or algal oil supplement. A common goal for joint health is a combined 1,000 mg of EPA and DHA daily. Always take it with food to help with absorption and prevent any stomach upset, and as always, talk to your doctor to find the right dose for you, especially if you're on any blood-thinning medications. A supplement that gets a lot of buzz for joint health is MSM, which is short for methylsulfonyl methane. MSM is a natural sulfur compound found in small amounts in plants, animals, and us. Sulfur is a critical building block for healthy joints, cartilage, and connective tissue. The thinking is that MSM helps reduce arthritis pain with its anti-inflammatory and antioxidant effects, helping to switch off some of the inflammation triggers that lead to pain and swelling. Now, what does the research say? It's a bit of a mixed bag, to be honest. One pilot trial found that MSM led to a significant drop in pain and better physical function for people with knee osteoarthritis. Other research suggests it works best when combined with other joint supporters like glucosamine or boswellia. While the science isn't a slam dunk for everyone, many people report feeling a positive difference. Doses in studies typically range from 1,000 to 6,000 ml per day. With MSM, consistency is key, as it can take a few weeks to notice the benefits. Never, ever underestimate the power of the simple things. Heat and cold are two of the easiest and most effective tools you have for managing your arthritis day to day, and they work in totally different ways. Heat therapy, like a heating pad, a warm bath, or a shower, is your best friend for relaxing stiff muscles and easing that chronic achy pain. Heat boosts blood flow to the area, which helps melt away stiffness and get your joints ready for the day. It's a perfect way to start your morning. Cold therapy, on the other hand, is for acute pain and inflammation. If a joint is swollen and angry after some activity, or you're having a flare-up, an ice pack wrapped in a towel is what you need. Applying cold for 15-20 minutes can help numb the area, bring down swelling, and quiet down the pain signals. The best strategy is to simply listen to your body. Sometimes alternating between heat and cold gives the most relief. It's a simple, drug-free way to stay on top of your symptoms. Living with arthritis doesn't have to mean accepting a life of pain and feeling limited. The big takeaway here is that by building your own natural toolkit, you can take back a significant amount of control. Think about the key pieces we've put together. Powerful anti-inflammatory herbs like turmeric and boswellia. Gentle, joint lubricating exercises like walking and Tai Chi. Essential supplements like omega-3s and MSM. And simple daily habits like heat and cold therapy. When you start combining these strategies, you create a multi-layered approach that doesn't just manage pain, but actively improves how your joints work, and most importantly, enhances your quality of life. There is so much you can do. There is absolutely hope. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and subscribe for more evidence-based health tips for seniors. And now, I really want to hear from you. What's one natural remedy you found helpful for your arthritis? Or which one from this video are you most curious to try first? Share your story in the comments below. Your journey and insights could be a huge help to someone else in our community. Let's support each other on the road to feeling better.